I chipped my tooth when I was like 13 years old, and so I've had a cap on it for a number of years. About 6 years ago, the post that they had used was failing, so they replaced the post. But I was concerned with the fact that it was loose, and Dr. Elliott was my best alternative.
When Scott initially came in, he said, I've always had this wiggly tooth, and it was a very obvious tooth that had super erupted, it stuck down. So we grabbed an x-ray and saw that it was completely shattered. I went through Scott's treatment options as a solution, and an implant was a very obvious one, especially since he had 2 healthy teeth on either side. And after looking at it, I decided that we could actually do this immediately, which was super attractive to him. It's going to save him another procedure, it's going to save him another healing, and it's going to save him about 4 months without a front tooth. So we extracted the tooth that was shattered into pieces. It was an old endo tooth, and we had to degranulate all of the infection, make sure it was out, irrigate, and make sure it was very clean. But he had a ton of good bone, so I was able to utilize a longer implant and get great torque value. We did PRF where we drew his blood, spun it down, mixed it with the bone graft so that he can heal better, and then placed an Os6 Plus membrane over top, sutured him up, and because of the technology, I knew where I was going, I had a plan, I was able to use a guide so the implant went exactly where it was planned to go. When I first approached my partner about buying cone beam and CEREC in the same year at the same time, there was a little pause because it's an investment. But what we didn't realize is that it was going to make it better. When I have a patient come in that needs an implant, we take a cone beam scan and then we take a prime scan of their teeth. I combine that information, and so then I can plan the implant. Once I plan the surgery and I write down all my thoughts and the plan, we get a guide designed, and we can 3D print that right in our office, and the patients are happy that it just pretty much goes seamlessly. It's easier to talk about implants when we show them exactly where we're going to put the implant. And in Dentsply Sirona, it's all integrated. I don't have to go off on another software here and another internet site here. So not only has it increased our production, but the patients are more excited about it as well. I love doing these procedures. I love giving patients teeth. I love the surgical part, but my team loves it too. And I think a lot of that is because they're so much more than just a spit sucker. They design the crowns, they make the crowns. We put our heads together and problem solve. It's given us so much flexibility for our patients, better care for our patients, and my team really takes pride in that. I can't rave enough about how much of a better dentist it has made me, but mostly how much better I can treat my patients. Believe me, if I can do it, anybody can do it.